Hi, my name is Caleb Drosh. Welcome back, licensed acupuncturist. In today's video, I'm going to be covering the topic of depression. So you really need to know how to treat depression because it will show up in your clinic. 1/4 of the U.S. population will experience depression at some point in their life, and they'll seek medication for it. And you can definitely help with that. Very, very helpful. And so the interesting thing that you should know is that about 60% of people who try the SSRIs don't really receive any relief or benefit or remission of the depression. So these people you can definitely help. And what I'm going to talk to you a little bit about is how to use the pulse to figure out where the depression is coming from. So what I see the majority of the time in my clinic, more than half, is that the depression is actually coming from liver function. Okay, so let's look at some of those patterns when it comes to the liver that are contributing to depression. The first one, the biggest one that I see, that you're going to see, is fatty liver disease. Or congested liver is one way that I explain it to people, because what happens is the liver isn't processing fat correctly, and what happens is it gets clogged up with fat. So their triglycerides are going to probably be high, and you can see that in the lab tests. And what this also does is it really restricts blood flow through the liver, so the liver can't do what it's supposed to do: conjugate, contribute to producing the right kind of neurotransmitters, right? So this will definitely show up in the pulse, and you can find it pretty easy to be able to tell. And there's little nuances as well that you'll find, is that you might have a fatty liver, and they're all the fatty liver, the congested part of it, it might be 40%, but there actually might be more of a severe blood circulation restriction. And so that'll show up as well. And when that's the case, then you can tailor the formula so it's weighing more heavily on the blood aspect of it, the blood restriction, right? Blood stack. So there's another liver pattern that will show up too, and that is if there's a weak liver. So it's the weak liver, or it'd be straight deficiency of the liver, also is a blood flow problem. So nutrients isn't getting into that liver organ. It's not getting enough oxygen. It's not giving enough nutrients to be able to make those conjugations, and typically that will also cause depression and also a kind of fatigue. So it's really, really helpful to be able to read the pulse, and then you can differentiate between those two. And I go into more detail of that in my course, really where you completely learn how to differentiate those patterns, and then you can tell what herbs specifically you need to give and how to tailor the formulas for that. So one of the mistakes that commonly happens is misdiagnosing depression coming from, say, something happening in the mind or the brain. And so if you do that, that's going to be a completely different herbal formula. Sure, Chong Pu, maybe some other kind of herb, Huang Qi, that you might think about giving that patient. But if it's coming from the liver, then in that case, if it's a fatty liver kind of condition with blood stag, it's really not going to do that much. You're not going to notice a big difference. The patient's not going to notice a big difference in the depression. And if you give the wrong herbs, obviously, like hotter, warmer herbs, that you're gonna create a lot of irritation in the patient. So don't normally see with liver excess, or really bounding, full pulse, a lot of heat, don't normally notice depression. That's going to be more of anger, irritability, something like that. Depression can happen like that, but usually it's a lot of anger and irritation. So this is something you can absolutely treat with Chinese herbs. You can also treat it with acupuncture, but the herbs are really powerful. It makes a big difference. This is something that you can definitely treat with herbology, and that's something that I go over in detail in my mastermind course that I offer. So thanks so much for joining me. I hope this was helpful for you to start thinking about depression in a different way and giving you confidence that you can treat this very, very effectively.